Hello, a very good evening to all of you. Today we are going to discuss the discharge letter, and this discharge letter is written to the patient Mr. Robert SMITHSON's general practitioner. That's Dr. Martins on 29 Cowslip Avenue, Berkeley. So let us go and see what the condition of the patient is from the very beginning. So you can say that you are a ward nurse working in the burns unit in Berkeley General Hospital, and the patient Rob Sanson, that is Robert SMITHSON, because it's all given SMITHSON. So we can correct it as Robert SMITHSON, a 22-year-old patient, a male patient who got admitted on 6th of April 2018 due to burns. He was in a house fire and he was admitted to the hospital, the general hospital. The time of admission, we assessed him and he had respiratory distress and he had partial thickness burns of which affected 18% of his total body surface area. Now, we are not going to write anything related to his medical history because we are writing to the patient's GP, so we're not going to write that. So we can write the present medical history, that is 18% of total body surface area affected, partial thickness burn, and respiratory distress, we can write. And now we have no need to write this social background because you're writing to the GP. Now we have to brief the nursing management and progress what we have done here. What's important is that the patient had respiratory distress. So we have given high flow oxygen that should be going first. Airway should go first. Airway, breathing, and circulation should go in order. So what we have to consider first is the intervention. The first intervention is oxygen. You clear the airway and given the oxygen. Now, related to circulation, now we have to go with IV fluids. That's primarily we are going with rehydration therapy. So that's here the patient has salt in his oral cavity. It's difficult for him to take something via mouth. So we have to supplement him with the IV fluids. So in order to maintain his fluid balance, so we have rehydrated him. Next is the irrigation. It's not irrigation, it's irrigation with running cool water. So tap water we used. So we have irrigated the wounds. Now, what we have to do is we have some normal things here which we do not need to address here. That's related to X-ray, electrolytes, ABC, ABG, cardiac monitoring, BP. So all these things we have examined and we have monitored the patient very closely. And we manage for, we monitored for the development of stridor. Nothing is present now, no abnormalities there. Now his patient is going stable, but he was on indwelling catheter. And something is important what he said, that he had head and torso elevation. So that's some intervention we have done. We elevated his head and torso above the level. So now about the medications, what we need to write, we need to update the GP about the medications which he had taken. That's naproxen, tramadol, gabapentin, and tetanus. Tetanus prophylaxis is something which comes, it's not actually the tetanus injection which is given. Prophylaxis in the sense we need to consider the patient education, the schedule, everything. So we have cleared it. So patient might have taken tetanus before, tetanus toxoid injection before. So we need to inquire and find it out whether when he has taken all these things. So it all comes in a package. So it's not actually specifically regarding. And if he has not taken, we have to give tetanus toxoid injection. So that comes in tetanus prophylaxis. It's not particularly giving tetanus injection. Now, patient stabilized and breathing normally, the progress, no infection, everything normal. Now, what we have here is the discharge plan. We have to arrange a community nurse, GP community nurse or burns outpatient for wound cleansing and topical dressing after the patient's discharge. After the patient discharge, we have to do daily auscultation either by the GP or the community nurse. So we need to go with that. Now, patient given instructions, how? So we have students writing all these things. So the GP knows what exactly these instructions are. So we can just brief it that necessary follow-up education was given to the patient regarding the burn care, diet, exercise, or something like that. So just brief it. It's not wise to write all these things in detail. It makes no sense. So what another thing which we have here is that the follow-up appointment, it is on 17th April at the burns outpatient. So we will be seeing the letter here. I'm writing to update you regarding Mr. Robert Smithson, who is recovering after a partial thickness burn injury. He's being discharged today. So very simple. We're not written something complicated here. We have written, so this letter is to update regarding Mr. Robert Smithson. And his diagnosis is given there, recovering after a partial thickness burn injury. So let's go ahead with the next part. Sorry. Mr. Smithson was admitted after being in a house fire on 6th of this month with 18% of his total body surface area burns. It was 18% total body surface area burns on his neck and chest. So he was admitted. He was admitted on 6th of this month. What caused his house fire? On this month with burns, here I need to make a correction here, with burns affecting 18% of his total body surface area. So we just made a correction here, so we need to make further corrections here. Mr. Smith was admitted after being in a house fire on 6th of this month with burns affecting 18% of his total body surface area, precisely or specifically on his neck and chest. So we have said clearly now, and we have corrected it grammatically. Mr. Smithson was admitted after being in a house fire on 6th of this month, that's in April, with burns affecting 18% of his total body surface area, specifically on his neck and chest. Good. Since he had respiratory distress, he was supplemented with high flow oxygen immediately and was rehydrated with intravenous fluids. So this is the first line measurement what we have given. The first is the high flow oxygen. The second is the rehydration therapy. Now, what we have done in addition to these two is the wound irrigation. In addition, his wounds were irrigated with cold running tap water. He was monitored closely at our care with his head and torso elevated. Okay, now I can join these two sentences. In addition, his wounds were irrigated with cold running tap water. He was then monitored closely at our care. So now it got connected. So after doing these preliminary things, he was closely monitored. Now let's go ahead with the next part. It's about the medications. Mr. SMITHSON's medications included naproxen, tramadol, about the dosage and the frequency given. He was also given gabapentin, the dosage, and had cleared tetanus prophylaxis. So whatever it is, whether TT was given or it was not given, it all comes under the prophylaxis. On his general assessment yesterday, he was stable breathing. He was stable breathing normally and had no signs of infection. Now, we would add he was seen stable, breathing normally, and had no signs of infection. So that's what the correction we made. Therefore, arrangements were made or were planned for wound cleansing and topical dressings under GP community nurse or burns operations. He was... Now I need to make either by the GP community nurse or at burns outpatients. He was also educated regarding self-care, such as diet and exercise. So what we have seen there, we had a lot of instructions given to the patients, like applying smoothness, having plenty of fluids, avoiding contact sports, all something instructions were given. So this all comes under the patient education. So just need to brief it because it's not that much important here. So the GP needs to know that education was given and what type of education, not that much detail. It would be appreciated if you could monitor him closely after discharge by performing daily auscultation. So you can say that the GP should monitor him by performing daily auscultation. This can be done either by the doctor, by the GP, or by the community nurse. Okay, so I can say preferably by performing daily auscultation. So this, in the case note, we can see that this particular auscultation can be done either by the community nurse or by the GP. So I just was asking him, because you're writing letter to the GP, so we are asking him, preferably you would perform. That's okay. Please be aware that he has a follow-up on 17th April at the burns outpatients. That's all the instructions. It's over. If you have any further queries regarding Mr. SMITHSON, please do not hesitate to contact me. Yours sincerely, Ward Nurse Burns Unit. So that's all the letter is, and hope that we'll be seeing you with another letter soon. Thank you.